The Elizabeth Glaser Pediatric AIDS Foundation, aka EGPAF, was founded 35 years ago by Elizabeth Glaser and her two friends. Both were determined to see a world in which families are not devastated by HIV and AIDS, and in which everyone has equal access to healthcare no matter where they live. Chip Lyons, their president and CEO, is joining me today at the Swift Hour. He's a longtime advocate for global health, a defender of human rights, and a visionary for equality. And he's led this incredible organization through a profound period of growth. Chip, thank you so much for joining the Swift Hour.
Great to be with you.
Set the stage a bit on the journey of combating AIDS and HIV. Put us into, if you can, a bit of context of where we've been and where we are today.
Goodness. Where we were was hellish. The emergence of HIV, the unknown, the SLIMS disease, because, as it was called in a number of countries, the wasting away of those that had the virus when there was no treatment. Any number of medical colleagues who were working on HIV and AIDS then in the 80s, for example, just have horrific stories where the most you could do is hold someone's hand because they were sick. There was no treatment at the time. You know, it was a pandemic. We all shuddered at the prospects of COVID. HIV and AIDS is a larger pandemic than COVID was. In that sense, thank goodness COVID didn't take on those proportions. But because of the scale, the severity, the death sentence that an HIV infection represented then, science activists, funders just went into high gear, politicians as well, to try and begin to develop some sort of treatment for those that had contracted the virus. President Bush made a historic announcement in creating PEPFAR, the President's Emergency Plan for AIDS Relief. I mean, countries at the time, I remember vividly, as it was known at the time, Swaziland. The projection for Swaziland is it would cease to function as a society. Such was the prevalence rate, the number of people that had HIV, the severity of it, and the lack of treatment. We've got terrific diagnostic tools. We have terrific medicines, treatment, antiretrovirals. We have the prospect of not having to take a pill every day, but having an injectable. For example, we don't have it yet, but it's coming to. Science keeps iterating and innovating and inventing. The political world and the funding world has to keep up with our scientists, such that we put all those tools into the hands of service providers and patients and those in need. So you have this remarkable situation of phenomenal progress, the largest investment by the United States government in history around tackling an individual problem, HIV and AIDS. Phenomenal, just some years away from epidemic control. Being that sort of tantalizingly close, and yet we have an enormous amount of work over the next 5 to 10 years because, among other things, children are being left behind by the global AIDS response. So you're kind of there, but we're not there. There's an enormous amount of work still to do.
Expanding a little bit on PEPFAR specifically, what was it about PEPFAR that made it so effective? And when it started, to what extent did everyone know the positive effect the program would have?
People hoped it would have a positive effect. They didn't know it was going to have a positive. You couldn't know at that point. When I've met any number of members of Congress that were a part of that initial authorizing of PEPFAR, I thank you for your faith. That was a leap of faith they took into the dark that this appropriation at that level was going to have anything like the effect that it's had. So they didn't know. But they just knew something had to be done, and some of the best minds, scientists, public health professionals, and others put together the pieces of PEPFAR and presented it to President Bush and his advisors and so on. And to his everlasting credit, he said, let's do this, let's go big, So they came in with, we could do this, or we could do this, or we could, no, we're going, people's lives are at stake. So huge credit to President Bush. On an operational side, PEPFAR has been successful for a couple of reasons. To use the jargon, it called for a whole of government approach. It didn't just say one agency is going to be responsible for this. PEPFAR is kind of an umbrella. There's the Office of the Global AIDS Coordinator. And the agencies that are a part of PEPFAR within the U.S. government include USAID, the Centers for Disease Control, the Department of Defense, the Peace Corps, Health and Human Services. And so you had these agencies with enormous expertise and power and influence on the one hand, but the secret sauce is President Bush wanted to know on a regular basis, how are we doing? Tell me what else we need. Do you have the support you need? Do you have the funding? You know, when the big boss is asking his cabinet or other leaders, including the head of PEPFAR at the time, and kind of holding them, President asks you a question like that, he's holding you accountable, right? And you know he's going to ask you that question, you're going to have good answers for him. And you're going to have worked with those other agencies to say, you know, here's what we got to do, here's what's expected of you, and so on. Another key element is they turn to some really important implementation partners. One of the first ones at the time was the Elizabeth Glaser Pediatric AIDS Foundation. They needed our help for a variety of reasons. They turned to ministries of health, who are arguably the most important partners in this, because they know their countries. They have their health system. They know what its vulnerabilities are. They know what kind of support. They know what people's attitudes are. What can they afford in the form of treatment? If it's nothing, then the Ministry of Health or the public health system has to make those treatments available. At the time there weren't any, but then they came online. So there are multiple reasons for PEPFAR's success. Let me add one other one. From the outset, there was a real commitment to having the best data possible. It tells you what you don't know about a disease you're trying to treat, about the number of people that are coming to a clinic, how many people aren't coming to how many are infected, how many of those that got tested know their own diagnosis, et cetera, et cetera. And PEPFAR really established a standard of expectation that it would be data-driven programs. That's evolved, became much more sophisticated over the years, because not everything in the first days was data-driven, because we were still in a stage of hope and so on. But PEPFAR, there are just countless lessons as to why PEPFAR, the 20th anniversary was recently, and just everywhere I turned, characterized as the most successful investment the United States has ever made.
And how often does PEPFAR have to be re-evaluated, recertified? Forgive my lack of terminology.
The word you might be looking for is reauthorized.
Exact. Thank you. See, I've never worked in government, so how often does
it shows? It's a virtue, by the way.
How often? Explain to me the reauthorization process.
Yeah, but your first question is important too. Sort of reevaluated. I think you said PEPFAR is kind of evaluates itself, and we're all, as a part of PEPFAR, we're evaluated on a regular basis. There's real rigor in, are these investments working, are these programs working, and so on. So that's kind of a technical evaluation. Reauthorization is one of two sides of the coin, where the President of the United States says, I want to do these things to confront HIV and AIDS. Is a two-step process in Congress. One is the authorization of the ideas, the actions, in this case, the president was calling for in a State of the Union address. And so you need Congress, the Senate, you need Congress to authorize legislation that says, yes, you can do those things with these parameters, these purposes, goals, and so on. That doesn't get you any funding. The next step is the appropriations process. The appropriations committees, so there are authorizing committees in Congress and there are appropriating committees in Congress, across government, not just in terms of foreign assistance or what have you. The appropriators take what's been authorized and figure out how much funding is required, commensurate with the scope of the authorizing legislation. And in the case of PEPFAR, it's been it was authorized and reauthorized several times. It tends to be has been reauthorized for 5-year periods. Technically, on the government calendar and fiscal year, the current authorization of PEPFAR expires on September 30th of this year.
And has it been reauthorized?
I knew you were going to ask that. No, we're in a ditch right now on reauthorization. It's a shame. Someone from the outside, yourself, who is not experienced in government, someone in Nairobi, someone in Johannesburg, someone in Abidjan, could reasonably ask, what's going on with PEPFAR? Is it being reauthorized? The short answer, including one I gave this morning to a first lady on the continent, is it will not be reauthorized by September 30th, because for political reasons. We are hopeful, we expect that there will be clean reauthorization for another 5 period. We're hoping that can happen still before the end of the year. There's no programming substance behind the hesitation to reauthorize. It's entirely a political, at this point, fight, where there are some that believe and say publicly that President Biden has, quote unquote, hijacked PEPFAR and is using it as an interest, as a vehicle to promote and fund abortion overseas. In my humble opinion, that's nonsense. And as the head of an organization that is implementing PEPFAR programs, the last thing in the world we would do is violate U.S. law and the use of PEPFAR funding. There is no credible evidence of that, but unfortunately there are enough who believe that in Congress that they don't have the necessary support for a 5-year reauthorization. So in the sense that President Biden is alleged to have hijacked PEPFAR to do these things that are not happening, the other side has hijacked PEPFAR to talk about just their passion being opposed to abortion. And so they are at loggerheads over this, and good people are working to try and close that gap and that understanding and that misunderstanding, because PEPFAR has never supported abortion.
Talk a little bit about you've addressed at this summit and other places the urgent call to action to the fact that children are being left behind. What do you mean by that, and so identify for us the problem and what you see as the solution?
Children are being left behind. The global AIDS response, particularly in the last period of time, the last several years, has left children behind. And what I mean by that, including drawing on the data that PEPFAR has, you've got 75, 80, 85% of adults, pregnant women, and others tested, know their status, if they're positive, on treatment, and so on. The pediatric population, 0 to 14, instead of being at 75, 80, 85, are at 45, 50, 55. In epidemiological terms, in public health terms, that's a canyon. That's not just your child's walking a little behind and you can see them and they'll catch up. No, in public health, that is an egregious lack of commitment and support for kids. And it has deadly consequences. I mean, if a newborn is exposed, meaning their mother's HIV positive, doesn't get tested, therefore is not diagnosed, therefore is not initiated on treatment, they have up to 50% chance of not surviving their first 2 years. There's an 80% chance they won't survive their first 5 years. So what you want and what we're capable of doing with the technology that we have is something called point of care diagnostics for kids. Mom gives birth, a sample taken, the test is performed, mom leaves the healthcare facility 12 hours, 24 hours, 36 hours, knowing the status of her newborn, she already knowing her own status, in most cases, not always the case, and now having medicine where that newborn, that infant, can take antiretroviral medicine, and that child's off to the races. They're going to grow up, they're going to be healthy, they might at various stages be stigmatized because they're HIV positive. At this point, they'll have to take treatment for the rest of their lives. But it's a monumental shift. And when we have all of those tools in our hands, it's just unacceptable. It doesn't quite cut it for me. That there were in 2022 84,000 children that died of HIV-related symptoms or causes, rather. They all should have been on treatment. They all should be alive.
Tell us, if you can, take a moment to tell us the story of Elizabeth Glaser.
Amazing woman who fell in love with a dashing Hollywood actor called Paul Glaser, if you were ever a Starsky and Hutch fan. And in giving birth to their first child, she hemorrhaged. She needed transfusion. This is in Los Angeles in the late 80s. And she got the virus in the blood supply, in the donated blood. Nobody knew that. Paul and Elizabeth had a second child, Jake, first child, a little girl named Ariel. Had a second child, Jake. Ariel was infected through breastfeeding after birth, which is another way you can through blood, but the virus passes from breastfeeding to, or can, if mom's not on antiretrovirals, in which case the probability of passing the virus shrinks to small. Jake was infected in utero. She was HIV positive, didn't know it. There was no standardized testing. There was no, And when the Ariel began to fall ill, they did everything they could, and finally, sort of the last test that they could think of was an HIV. Of course, it's not HIV, but it was HIV. Ariel passed, and Elizabeth just wrote, and they tested the rest of the family. She's positive, Jake's positive, Paul was not. And she just rose up like this lioness, protecting her, mourning Ariel's passing, and using that for the energy she needed to advocate for Jake and potentially other children. So there's no research being done on pediatric HIV. There's certainly no treatment. It's just not on anyone's radar. And she changed the way America thought about HIV and AIDS. Well, I don't know about wealthy, but celebrity, white heterosexual couple, has been devastated by HIV. So she pushed for research on pediatrics. She helped raise money to fund promising young med students to focus on HIV and to focus specifically on pediatric HIV. Around here somewhere, there's at least someone that received a Pediatric AIDS Foundation fellowship, which inspired them, led them to study pediatrics and pediatric HIV as a part of their residency and so on. Unbelievably prescient, strategic. You don't have a lot of money, so what do you do strategically to influence a field for the next 30 years? I mean, who thinks like that anymore? It's phenomenal. She spoke at the Democratic Convention, here in New York City. But there still wasn't adequate treatment, and she passed as well. Jake is a healthy young man, and he's a living testimony to how effective she was. She had allies, her two closest friends, Susie Zegan and Susan De Laurentiis, were at her side and strategizing together, coming forever to Washington to lobby President Reagan. And you remember C. Everett Koop, who was a phenomenal Surgeon General at the time. But Elizabeth stirred the pot, and she had a personal story that was impossible to ignore.
Chip Lyons, thank you so much for taking the time today for this conversation and for joining the Swift Hour.
Thank you for having me.